Perfect. And I'm just going to wait to everybody can connect to audio. I see it loading.
Like some slow connection times this morning.
I know. It must think it's a Monday. See, everybody's confused. Okay, I'll let Susan catch up, but let's get started. Hello and welcome to South Dakota Project First Line office hours. It is December 2023 and we're discussing bloodborne pathogens. For anybody new listening, we cover a different topic every month and you can join us virtually or you can check out our previous office hours on our YouTube channel, which we'll provide a link to at the end of the presentation, or you can just look us up at the South Dakota Project First Line. All right. I am Jamie Rogenbauer. I have a master's of public health from South Dakota State University, and I like to pop into office hours, but I spend most of my time with Ryan White. Who you normally see is Jess Stanko, and I'll let her introduce herself.
Good morning, everyone. Thanks for joining us. Yes, I am Jess Stanko. I have a background in healthcare administration. I'm a registered respiratory therapist and also certified for infection prevention in the long-term care setting.
Awesome. And then also with us is our favorite RN, Rebecca. If you want to introduce yourself.
Yes, I'm Rebecca Syme. I'm a registered nurse. I have a varied background in different areas in healthcare, including the OR, SPD, ED, dialysis, long-term care. Thank you.
Awesome. All right. Well, we work with the South Dakota Foundation for Medical Care, but Office Hours is a collaboration with the CDC and the Department of Health as South Dakota Project First Line. This collaboration actually began with COVID. There was a big need to bring infection control to our frontline healthcare workers. And so that's what we continue to do, even though the public health emergency is over. Infection control is still extremely important for COVID and for other infectious diseases. So we do this every month. And before we jump into our bloodborne pathogens, we provide all kinds of cool resources for your clinic or for your site to utilize. We have a few of them here that are topical to our bloodborne pathogen presentation. They're pretty fun posters. They're easy to read and they're great tools for learning, or even just really, really great reminders of our best practices for infection control. All right, and then this is kind of a generalized guide of what we're going to do today, but it's also a great tool that you can use for your teams to cover any kind of infection control topic. It's meant to create conversation, get buy-in from your team, listen to everyone's thoughts, and then come up with some cool ways to work on infection control where you're at. All right, blood. No, it's not Halloween. It's blood, and it's somewhere that it should not be. Okay, so how can blood become a bloodborne pathogen? There are three main ways. Needle sticks, never fun for anyone to get a needle stick. Breaks and cracks in your skin. This is so common, especially here in South Dakota in the winter. Our skin is dry and gets cracked, but especially for our healthcare workers who are constantly washing their hands as they should, they can develop really dry and cracked skin so quickly, and so make sure you're moisturizing when appropriate. And finally, splashes and sprays, most common to our face, very gross, right? This can happen when cleaning surgical instruments, working with patients, working in the lab, and it's a lot more common than we think it is. So what do we do when we see blood? We always assume it's infectious and we clean it up immediately, always using our appropriate cleaners. We wear gloves, never clean up a blood spill without gloves on, and remember our dry, cracked skin are those openings for that to get in there. And immediately after the spill is clean, we need to perform our proper hand hygiene. Sing your ABCs. You can even remix it backwards if you're sick of singing that song. And then now another danger spot is our sharps. So sharps can get hidden sometimes on work mats and patients' rooms. So be on the lookout for sharps when you're cleaning up your areas, especially around blood. We are talking about bloodborne pathogens. And when you see them, always dispose of them in the sharps disposal containers. They're these fantastic red poke-proof containers. And the best way to dispose of sharps and mitigate that risk of poke is to keep track of them. So best practice is put them in the same spot every time and clean up, have a process for that so that you kind of know where they're going to be, but always be out on the lookout. Okay, so this is discussion with our team. Think about those big eyes, scary. It's not Halloween, but we see blood. What do we do when we see blood? Remember our gloves, assume it's always infectious, and always clean up with those appropriate cleaners. Let's talk about should be worried that we're going to catch something. Bloodborne pathogens, they are prolific. That's why we are discussing it here, so that we can eliminate infection and really decrease that prevalence that someone could get a bloodborne pathogen. So remember our gloves, look for sharps, wash your hands, and moisturize those dry, cracked hands. All right, and do we have all the tools and information that we need to do our job safely? So this is where those great resource posters could come in mind, but just make a plan within your clinic or your site for those practices to make sure that we are doing those appropriate things to prevent those bloodborne pathogens. And then talk to each other about ways that we can prevent that spread, or maybe like reorganize our best practices to kind of prevent those things from happening in the first place. It's always good to have a conversation about it. Okay, so wrap up and reinforce before I hand it over to Rebecca. She's got some great slides, but remember, be on the lookout for blood. Pathogens spread really easily in openings on our body, especially our face. Clean and disinfect blood immediately when you see it. Look out for sharps and handle them appropriately. Remember those fantastic red poke-proof boxes. Know your resources and utilize ours, of course, and then work as a team to prevent any kind of bloodborne pathogens that might occur in your area. All right, Rebecca, take it away.
Oh, that was great, Jamie. Thank you. What we're going to move into next is just thinking about some areas where you work that might have blood in them, areas of possible contamination. The photo on the left there, as you can see, that's the top of a sharps container, and you can see that there is blood on there. So if you see these things, you want to be mindful that it is your responsibility. You're the one who saw that. You should get the appropriate product, one with bleach, and clean up the top of that with your gloves on. Like Jamie said, make sure we always have gloves on. On the right there, the bin that is located below the working bin on the top is full. And, you know, is this the best use? This cart also has some tape on it. We don't want to use tape, things like that. So just being mindful of how you use things. Could it be a better process to prevent possible sharps injuries? Next slide. So on the left there, you can see storage in a lab. And I think there is a lot happening in that photo. But you can see there are blood contaminants there in that fridge. So if this is in your area, it is, you know, your responsibility to make sure you're wiping down that blood drips when you see it, making sure those bins are clean and organized, and maybe just thinking, could you have a better system for that? Same thing on the right. You can see that that sharps container, our biohazard container, is overflowing. For sure, you want to replace those things before they look like that. And be mindful that, not sure if that's a blood splatter on the countertop there, but making sure that we're keeping that, wiping that up if it is blood. Next. This is a picture of blood on the floor. This particular one was walked past over and over and over, and no one took the responsibility of cleaning that up. So the first thing you should do when you see this is safely stop doing what you're doing, find the appropriate product, cleaning, disinfecting product, and clean that spot up right away. The photo on the right there I included because
Your door.
Yeah.
washing your hands and things like that, you know, is important in between
wish
glove
you didn't
changes. And, you know, we want to make sure that we have a safe distance from a sink. That includes 3 feet, or we need to have a barrier placed there. But as you can see on the left also, it looks like a bin that has items that would be used for glucose testing. And again, is that the best place to store them? And just a review of your process, along with some meds on the other side of the sink. Next picture. This is a piece of equipment into the lab, and as you can see, the splatter happened on the lid while this machine was processing, and it was just sitting there ready for the next reuse. So again, when it comes to blood, if you see it, it's your responsibility. You want to address it yourself right away if you can. And if not, you want to make sure that that's put out of commission until you find the person who can help you clean that up. We clearly don't want to be reusing that piece of equipment with that blood product splashed on it. So being mindful to take care of these things as soon as you see them. Next slide. Sharps containers. I know we had a facility recently, I suppose in the last few months, get a survey tag for sharps containers that were not secured. I think during COVID, we maybe had a little looser guidelines on some things, which we're all aware of because there was a lot of other things that were being focused on. But your sharps containers should be in the locked boxes appropriately. As you can see, the sharps container on the left there is hanging open, and the one on the right is in a homemade container of some sort. So when you see these things, try to work towards improving the process for them and make sure that they're safe and appropriately being used within your facilities. Next, please. The picture on the left there is a sharps container. We see this almost everywhere out when we're out. They're kind of used for storage. So this one has keys. Sometimes it's note paper. Sometimes it's a box of tissue. Sometimes it's even been stethoscopes. So that's an area where contamination is likely. I mean, it's right by the sharps opening there. So we want to make sure that we don't store anything there. And that one also looks visibly dirty around the front there. So making sure that we keep that clean. The photo in the center actually is a glucometer, which I like that they say place the clean meter here to dry. However, the process that this facility was using was they were taking the glucometer into a patient room, performing the blood glucose test, and then not cleaning the glucometer until they brought it to this site, which was down the hall. And after being aware of that one, we have had conversations, and there are several facilities that practice this, that it's just transplanted from point of use to the clean area. Then it's cleaned with the bleach wipe there, for example, in this photo, and then placed in there. The only thing with that is if you think about that, anything that you probably sat that glucometer down on something, you took your gloves off, performed hand hygiene, you grabbed that glucometer, you made your way down the hall, maybe you touched a light switch, you helped a patient with their tray, or, a multiple of things could have happened. And if that wasn't cleaned at point of care, then you have potentially caused multiple contaminations until you reach this point at which it gets cleaned. So just review that in your practice. It's probably best to clean that at point of care, and maybe it's okay to clean it for a second time before you place it in that meter. On the right there, just some things. You can see the glucometer is sitting on that bedside table next to the water and next to whatever else is there. So is the lancet. We want to be placing a barrier, or we want to clean that surface with the proper disinfectant and let it completely dry before we place those items on there. So a paper towel or a barrier like that. Another thing I note is on the floor is the call light cord, and then the oxygen tubing. Those are also things we should be mindful of while we're in there performing that task. Next. Fly swatters. Fly swatters we don't want to have them, but do we see them? Yes. And what do fly swatters also have on them? Blood, right? So if you swat a fly in one room, or a mosquito, and that had blood on it, and now you're just taking that thing to another department or another area, or you're reusing it, that is blood. There's another area for blood contaminations with pathogens in it. So get rid of the fly swatters, probably. That'd be a great idea. Next slide. And then the way that we're cleaning things. So, if I'm going to clean up a blood spill with a mop, that picture on the left needs some work. We want our stuff to always be clean, even the things that we're cleaning with. So if we take that out and we're going to clean up a blood spill, are we potentially just increasing the pathogens that we're going to put in that area if our facilities equipment looks like that? So be mindful to keep these areas clean. your cleaning carts, your supplies, those types of things, as well as if I just cleaned up a blood spill and I went to reach my hand under this alcohol-based hand sanitizer, I mean, it looks pretty dirty too. So could I potentially pick up a different kind of pathogen from there? So just be mindful of those items. Next. Wipes. Wipes in general, I wanted to talk about. You know, when we talk about blood, we want to make sure we're using the appropriate wipe. But in general, these pictures showed a good example of what not to do with our wipes when we're not using them. When that lid is open, there's potential for that chemical that's been pre-measured, pre-designed, pre-tested to be the exact amount of chemical in there for each and every one of those wipes to work effectively when they're pulled out. And when we have the tops open like that, it's slowly, gradually drying some of that product out and decreasing its effectiveness. This is something we see a lot. The photo on the right there, you can see, I mean, there's hair and dirt and debris hanging off that wipe. So if I go to use that, I'm probably also picking up other contaminants. So more things to be mindful of. Next photo. That wraps it up. So yes, thank you. Thank you everyone for your time and attention today. I hope we taught you and maybe enlightened you and maybe gave you a few things to think about today. Jamie or Jess, do you want to add anything else?
Yep, just going to open it up for questions for a minute. If anybody has any questions, you're certainly welcome to come off mute or place those in chat. If we don't have any questions, we will go ahead and wrap up for today. We'll just give it another minute.
Transition to the next slide with the QR on it. Oh, yes.
Always remember, you stop bloodborne pathogens. And then here we go. Here's our QR slide. So here's where you can view our past office hours. We have a lot of great topics. Like I said, a new one every month. And it looks like, do we have something in the chat, Jess?
Just a thank you and great reminders. So we will go ahead and wrap up for today. Thank you guys for joining us. If you would like to share this out with your staff, the recording is available to you on our website. It's created for that purpose to be able to utilize throughout your facilities. Thanks for joining us. Otherwise, have a great day.
Thank you, everyone. Have a good holiday season.